Polyposis syndromes are a group of genetic disorders that cause the development of multiple polyps in the colon and other parts of the gastrointestinal tract. These syndromes are significant challenges in the medical world due to their genetic complexity and the silent nature of their progression. The development of the polyps, which are abnormal growths, occurs predominantly in the colon, but they can also be present in other areas of the gastrointestinal tract. The polyps that are formed can be either precancerous or directly cancerous. Precancerous polyps, also known as adenomas, have the potential to develop into cancer if not identified and removed promptly. On the other hand, cancerous polyps are already malignant and pose a more immediate threat. These polyps' unpredictable nature is what makes them so dangerous. One can never be sure if a detected polyp is precancerous or already malignant. The risks associated with these syndromes are high, especially left untreated. Over time, the sheer number of polyps increases, and so does the probability that one or more of them might turn cancerous. This is a significant concern, as polyps are often asymptomatic, meaning they do not present any obvious symptoms until they potentially become malignancies. The ultimate risk of untreated polyposis syndromes is the increased likelihood of developing colorectal cancer. Colorectal cancer is one of the most common types of cancer worldwide and is often deadly if not caught in the early stages. The link between polyposis syndromes and colorectal cancer is well established in medical literature, and thus it is of utmost importance to detect and treat these syndromes as early as possible. If left untreated, can lead to an increased risk of developing colorectal cancer. There are two main types of polyposis syndromes, adenomatous and hamartomatous. The adenomatous type consists of different syndromes including Familial Adenomatous Polyposis, FAP, which is a severe form of this disease that usually occurs in young adults. The Attenuated Familial Adenomatous Polyposis, AFAP, is a milder version of FAP. MUTYH-associated Polyposis, MAP, another type of adenomatous polyposis, is caused by mutations in the MUTYH gene. These syndromes are all caused by mutations in specific genes that influence the growth and division of cells. The hamartomatous type of polyposis syndrome, on the other hand, embodies syndromes like Peutz-Jeghers Syndrome, which is characterized by the development of polyps in the gastrointestinal tract and pigmented spots on the skin and mucous membranes. Other instances include juvenile polyposis syndrome and Cowden syndrome, both of which involve the formation of hamartomatous polyps. On the other hand, hamartomatous polyps include syndromes like Peutz-Jeghers syndrome, juvenile polyposis syndrome, and Cowden syndrome. Familial adenomatous polyposis is the most common type of polyposis syndrome. This stands out among other genetic disorders due to its high prevalence. It is a condition that is passed down through families, a hereditary disorder, which makes it even more significant. The culprit behind this syndrome is a series of mutations in a gene known as the APC gene, a key component in cell cycle regulation. The APC gene is instrumental in maintaining the balance of cell growth and death. But when mutations strike, this balance is disrupted, leading to uncontrolled cell growth. This abnormal growth then leads to the formation of polyps. These aren't just a handful of growths, but hundreds to thousands of polyps that develop throughout the colon. This often results in a noticeable thickening of the colon wall. The condition is fairly serious, not because of the polyps, but rather what they represent. They're precursors to a more severe condition. If these polyps are left to grow and multiply without any medical intervention, they can develop into a dangerous form of cancer, colorectal cancer to be precise. The risk is so high that practically everyone with FAP who doesn't receive treatment before they reach the age of 40 will develop this cancer. This represents a nearly 100% chance of developing colorectal cancer by the age of 40. Attenuated Familial Adenomatous Polyposis is a milder form of FAP. Though it might be a less severe form, the underlying cause is the same. The mutations that we see in the APC gene are responsible for this condition, irrespective of whether it's the attenuated form or its more aggressive variant. Despite being categorized as milder, AFAP is not something to be taken lightly, as the people suffering from it are still plagued by polyps, but to a lesser extent than those suffering from traditional FAP. Typically, the number of polyps developed by an individual with this milder form of the disease is less than 100. This smaller number, however, is not indicative of a lesser risk. The dangers associated with AFAP are far from being negligible. In fact, there lies a daunting reality beneath its milder label. The risk of developing colorectal cancer is still significantly increased. MUTYH-associated polyposis, often abbreviated as MAP, is caused by mutations in the MUTYH gene, which is a protein-coding gene. This gene is instrumental in the body's ability to maintain the integrity of the DNA structure, and so any mutations in this crucial gene can lead to serious health implications. The most significant of these health issues is that individuals with MAP develop multiple polyps in the colon. These are small clumps of cells that form on the lining of the colon. Over time, these polyps can grow in both size and number. This growth can lead to various uncomfortable symptoms, including pain and changes in bowel habits. Furthermore, an individual with MAP has an increased risk of developing colorectal cancer. Colorectal cancer is a very concerning health problem. It's the development of cancer in the colon or rectum, parts of the digestive system. This type of cancer can take many years to develop but is very serious when it does. The development of this cancer in individuals with MUTYH-associated polyposis is indeed a major concern. However, when we consider the risk of developing colorectal cancer in relation to other conditions, such as Familial Adenomatous Polyposis, FAP, and Attenuated Familial Adenomatous Polyposis, AFAP, the risk in individuals with MUTYH-associated polyposis is relatively lower. This lower risk does not, however, reduce the critical need for continuous monitoring and proactive treatment for individuals with MAP. Despite the potentially lower risk, it's vital for these individuals to keep up with regular medical checks and interventions to mitigate any risks and ensure optimum health. However, the risk is lower compared to FAP and AFAP. It is important for individuals with polyposis syndromes to undergo regular screenings and surveillance to detect and remove polyps before they become cancerous. It is a crucial step in proactive healthcare management. This is primarily because these syndromes are typically characterized by the development of numerous polyps in the digestive tract. These polyps, while often benign, can potentially transform into cancerous cells if left untreated. Hence, it is essential to have regular checkups to monitor any changes or unusual growth. These screenings are typically conducted using endoscopic procedures that allow doctors to examine the colon and rectum in detail. Additionally, surveillance is necessary to assess the progression of these syndromes. It provides an understanding of the growth pattern of polyps and helps in determining the frequency of follow-up visits. The plan includes a variety of options, informed by the number, size, and location of these polyps. One common approach is surgery, which involves the removal of the colon. This procedure, although invasive, can effectively prevent the advancement of the condition. However, surgical intervention isn't always necessary. In some cases, medications can be used to manage this condition. These drugs work by reducing the number and size of polyps, thereby minimizing the risk of them becoming malignant. Treatment options may include surgery to remove the colon or medications to reduce the number and size of polyps. In conclusion, polyposis syndromes are genetic disorders that cause the development of numerous polyps in the colon and significantly boost the likelihood of colorectal cancer. Polyposis syndromes are influenced by a variety of factors and are often linked to our genetic makeup. These syndromes are an umbrella term for a group of conditions characterized by the development of multiple polyps. Polyps are abnormal tissue growths that can develop in any organ with blood vessels. They are most often found in the colon, but can also develop in other parts of the body, including the uterus and the stomach. The connection between these syndromes and cancer is a complex one. It is not that the syndromes themselves cause cancer, but rather they considerably heighten the risk of developing it. This is largely due to the polyps that are typical of these syndromes. While most polyps are benign or non-cancerous, a small percentage can become cancerous if they are not detected and removed. This connection underlines the critical importance of early detection and treatment in managing these syndromes. Through routine screenings and regular monitoring, doctors can identify and remove polyps before they have a chance to turn into cancer. Additionally, research is ongoing to develop new treatments and interventions to manage these syndromes more effectively. Early detection and treatment are crucial in managing these syndromes and reducing the risk of cancer.